I felt lost. I was lost. And I don't like feeling lost because I'm the kind of person who always needs to have control over what I do. I need to know what's going on. And when I don't even know whether I got cancer or not, so I got lost. And you actually showed me what is going to happen next and show me a bigger picture. And that was such a relief. Hello, Dr. Tan.
Hi.
I am so excited to see you today because this month is my 1 year cancer diagnosis anniversary, so that makes me 1 year a cancer warrior.
Congratulations. You did well.
Thank you. With all your advice and all your help and all your, consolation, it helps me to have strength to go through what I needed to go through.
You didn't need much consolation. You were always very positive.
Positivity is, I think, sometimes overused because there's a lot of people tell me that, but I also think that those parts where I was down and I was crying and I just didn't want to see anyone, people don't really see that, right? And I also shared my journey on social media. Of course, those times when I was already sad and so depressed, I'm not able to pick up the phone and and I also feel like I'm a fake life, like start crying in front of camera. So you only see a certain part of it.
Correct.
Yeah, but when I first met you, I walked in when I got to know about my lump. I walked in, I called, and I'm so glad and I'm so grateful that you agreed to actually see me without an appointment. So thank you for that. That was such a, I don't even know how to describe it, but it's just so good to know that what it is, because I was in the dark for a long time about it. So do you remember that day when I walked into to see you, or you had too many patients to even remember?
Vaguely remember.
You vaguely remember. I don't know, was I nervous? Was I, I know I'm not who I am today.
Yes, you're a little bit nervous.
Okay.
It's sort of like also prepping for the worst, but you needed an explanation. I think the most important thing, I think, that makes the consultation that goes the other day is that we have a thorough examination. We talk about the scans finding, then we explain the necessity of doing a biopsy. So by step, then when you understand the flow of the process, I think you sort of like calm down and you're okay.
Wow.
And you ask questions, which is good.
Okay. Nice.
So I think that helps with the process. But I have to say, overall, you're very good.
Well, I think because most of the time we don't have the information at hand.
Yes.
So that's when the fear comes in.
Correct.
Right? And also my experience waiting outside your clinic, looking at patients coming in and out, I can see from their face, they probably have the same feeling that I did. And usually when we wait for something, we can actually look at our phone and Google and search. I can tell you that was the first time in my life when I was waiting for something for almost 2 hours. I can't even look at my phone. That's how nerve-wracking it was. And having said that, you have seen so many patients and people who come in to see you. What were their first few reactions, or how? Because I reacted how I reacted. How about the rest of the people?
I think most people, when they come in, the very severe one, they sort of have an idea, but they just need somebody to confirm their suspicions. Like they know something is not right, but they for some reason, probably they delayed seeking treatment for a while. But then when they come in, they sort of have an idea. But of course, we get a lot of early cancer that the screening detected, which is totally unexpected. So we get two extremes. But I think so. But the key thing is that when it comes for diagnosis or breaking the bad news, so we see that a lot of people are actually shocked, and sometimes you have anger, and then they also have denial. So I think anger sometimes is only anger to themselves, sometimes also to the surrounding environment, or maybe the people around them, or they sometimes even angry at the doctor. Because though there's nothing to do, but it's just at that moment, you know, it's like because they're being told something that they're really not prepared for. So people go through change or emotion like this. It's actually very normal. So I think for me, I felt that the important thing is explain to them, like what you say, not knowing is actually scary. So we tell them usually when breaking the marriage, do not need to make any decision today. Okay, you just listen and ask questions. You have time to think about it so that you know when you have in a calmer mind, and then you can digest the information. You come back, then we plan the management together. That is usually the scenario.
How do you keep yourself composed? Like you have to break the news, right?
Yes.
And I cannot imagine myself telling someone you have cancer. And you have to do that on a daily basis.
Yes.
I mean, how do you regulate your own emotion?
It's tough sometimes, you know, especially when unexpected one, in the sense that sometimes you get very young women or you get those who got breast cancer during pregnancy. Those are the tough ones, the really tough call. And then even had one patient before that was going for IVF, waiting for the embryo to be transferred, and the week before we diagnosed her with breast cancer. So it was actually it's like a major trauma to her as well. So for me, I find that usually I try to understand the patient's background and also the support, what kind of support that they have. Not only family support and also financial support, whether they have enough means to continue treatment in a private hospital. If not, what will be the better choice for them? Okay, I think all these are things that we discuss about. And of course, before breaking bad news, I prepare myself, I take some deep breath. And then I think empathy is important. We put ourselves in their shoes, you know. So tell them in a way that is not overpowering, in the sense that I'm sharing this news with you. This is what we're getting, and then this is how we understand it as is it. This is part of the disease, and then our plan is like this, like this, like this.
Yeah.
Okay, I write it down so that they have a record, because at that time they actually don't remember anything. So if they have family members who come along, ask them to invite them to come in if the patient agreeable. Or sometimes they even say, if today you can't, next time you can actually bring your family members. We can talk about it together. So I think important is listen to the concern, okay, and tell them what do you think. But just tell them this is my advice. But you can always go for second opinion. I think second opinion is very important to the patients, because sometimes patients are panicking, you see, so they just make decision. Okay, I'll go for surgery tomorrow. But this is the kind of patient that we don't really want, because they're not in their right mind, they're not thinking through. Okay, because sometimes you have a few options. So we actually wanted to take time to think about it. Okay, they can think about it themselves, they can discuss with family members, they can go for second opinion, so see whether the other doctor think the same as well. So I think once they have done all this, they are more settled. They sort of have a clear mind what they want to do. Then when they understand and determine what they want to do, then they'll be able to follow the plan of management. That makes the whole process easier.
Yeah, I remember that helps a lot, because when you come, because you mentioned people come in feeling angry, feeling frustrated. I felt lost. I was lost. And I don't like feeling lost, because I'm the kind of person who always needs to have control over what I do. You know, I need to know what's going on. And when I don't even know whether I got cancer or not, so I got lost. And you actually showed me what is going to happen next and showed me a bigger picture. And that was such a relief. It was such a relief, and I think that was and after we confirmed my biopsies that I got cancer, actually I felt happy, because at least I know from whatever that you explained that this is what we're going to do. We're going to go for a lumpectomy, and then you're going to go for your treatment, and then how long this is going to be might take about 3 to 4 months. So that's really, really helpful about the information. And you know, when I was observing outside the clinic, and every day, you know, your clinic is full with people, with patients, and it got me wondering whether have the number of breast cancer cases increases in the past years, or is it just that because people have more access to advice that they start to come out to ask?
Yes, I think definitely we have seen an increase. And then I think the reasons are like what we mentioned, what you have mentioned just now. Definitely there's a clear increase, and we're seeing a younger age group as well. Now we see a lot more like in the 30s. So we always say before 40 is considered young breast cancer. But recently I see a whole lot who are like in their late 30s. So I think part of the reason as well, people are more health conscious, so that in their 30s they actually start doing health screening. So we're actually able to pick up very, very small cancer. So we have stage 0, we have stage 1, and this patient they do very, very well. So I think in a way it's good because they don't come later, which is a couple of years later, and present at stage 3 and stage 4.
So you're saying that the number of cancer has increased,
Yes.
and you see it from younger women.
Correct.
So that is data, right? That's
Yes.
statistics. So for somebody who is watching right now, and I'm a 30-year-old young woman, is there anything that I can do to not be diagnosed cancer, or is there any preventive?
Yeah, I think we'll talk about, first you must know what is called breast awareness. That means you're aware of the changes on the breast. If I ask a lot of women, actually they say, I probably never examine my breast, They say because I don't know how. So I think knowing how to do breast self-examination is important. And there's a lot of video that you can watch, okay? Or sometimes when you go to a doctor's clinic, you can actually ask the doctor to show you how to do it. All of us actually very gladly will show you how to do a breast self-examination. And second, why do we use the word awareness is because it's not only about examining or palpating your breast, it's also that you are sensitive to the changes, like is there any skin changes, is there any nipple changes, and then nipple discharge. So all these are the minor things that you actually can see. Because a lot of time that the breast cancer are actually painless lump. So people will just leave it alone. It's painless, it doesn't disturb them. The painful one is the one who rush it, but actually when you have painful lump, most of the time it's actually non-cancerous. Yeah, so I think being aware of own breast changes is actually very important. And of course, we talk about how to reduce the risk. So it's a lot to do with lifestyle. Because genetic, of course we know genetic carries some component in breast cancer, but it's only, we know from statistics, it's only about 15 to 20% of breast cancer survivor actually have a family history of breast cancer. So 80% is about what we call a sporadic case, that means just standalone cases. So I believe that, other than the normal things that we know about age of having the first period, having children, breastfeeding, all this will reduces your risk factors. But also lifestyle, in the sense that sedentary lifestyle definitely increase our risk. So I always tell them, please exercise. Exercise is important, and then make sure that we're not overweight, because excessive fat in the body can also increase our risk of breast cancer. And one more thing is stress. A lot of people are having a lot of stress. I think stress, in a way, it also does some negative effect to our breast health as well.
Yeah, because recently, I found a research on psychosomatic factors that contributes to breast cancer, and I was like, this is a new word to me, and I was very intrigued, because in my journey still, I would like to know more about the causes, because at this point you just don't know, and you just want to get better. So they said that psychosomatics are the stresses that people go through, the suppressed feeling that they have, and also going through very challenging life events.
Correct.
So do you have any comments with that? Like, do you see that in your patient when they come in?
Actually, yes, though I don't have like a data, but we talk to the patients, so we actually, over time, so we all become like friends, we actually know all the major events that happen in their life. So I think I have quite a number of patients who actually shared that, before they were diagnosed, maybe within the past 1 to 2 years, they usually have some very stressful periods. Some could be the loss of loved ones, some could be taking care of some sick people for a long time. So actually, everybody has a story. So I think that definitely contribute as part of the cause.
Yeah, because I'm also one to advocate on the holistic healing, because when I go out and I tell people that I had cancer, or I was diagnosed cancer, and the first thing they say, you makan apa you sebab you makan ni, so that I get annoyed. because I probably eat healthier than you,
Yeah,
right?
correct.
And because there's judgment there,
Yes.
and I feel that this is the easiest thing people can say. What did you eat? Or you must have not eaten health. So there's judgment there. But if they actually look at it in totality, if you eat healthy, also if you exercise and be in the best version, the fittest person that you can be, but still deep inside you're keeping so much, there's anger, resentment, fear, and all that not playing inside the body, then that is still a place where the cancer loves to live in.
Correct.
Right?
It have a negative effect.
Yeah. So, but because you can't see the negative energy, so it's easier to say it's coming from the external stuff.
Because people usually like to say things that they can see, they can measure. And I also find that a lot of people, they actually don't realize they're under stress. So they're in stress, but they don't realize they're under stress. So I think we always have to take time to examine ourselves, to ask ourselves that, are we under stress? Because a lot of, let's say, all these women, they're probably a housewife, they're working mom, they are rushing from morning until evening. They don't even have time to think about what's happening to themselves. So when this hit them, they actually hit them quite hard.
Yeah, I totally agree, because the first thing when I got diagnosed, I was like, how? I was in a denial. I can't believe that I have cancer, because I think I'm okay. I don't think I put myself at risk health-wise, and a lot of those reflection came in. Like, maybe I was under stress, but I normalized my stress. So I never realized. So it becomes like a lifestyle.
Correct.
And that's the danger of it, when we make stress our lifestyle, right?
Yes.
Yeah, so all this start to manifest through critical illness.
Correct.
Yeah. And so talking about all these factors that could make us sick, right? So when I found my lump, when I was showering, it wasn't painful. Yeah, so now I learned something, that because I get questions, people asking me, saya punya lump ni tak sakit, cancer ke? I said, I'm not doctor, so you please go and see doctor. So when I first got to know, it wasn't painful, right? And normally we don't walk into hospital if there's no pain.
Correct.
But I had a big fear. I had fear of a foreign thing in my body. So that's when I, I just came to the hospital and walked in to see you. But how about other patients or other women out there? There are still that fear that they have, or maybe they think that, it's not painful, so why should I go and check? What is this? So how do we encourage people to come in and walk in, or find out just at the point where they found something abnormal?
Yes.
Yeah.
So I always encourage to say that, breast, you also need to go for screening. Like how a lot of people go for blood tests religiously every year to check for cholesterol and sugar and all those things. Actually, breast should be one of the things that you should check as well. Okay. And then especially when you're asymptomatic, that means you're perfectly well, you're asymptomatic, you should still go for screening every 1 year or every 2 years, depending on your risk factor. But when you have a lump, sometimes when young woman or some middle-aged woman, you have a lump, sometimes just before period, it's quite normal because of the hormonal changes. So my advice is, wait, if 2 weeks later the lump is still there, then please see a doctor. That would be the best thing. If the doctor do a scan, they examine you and do a scan, there's nothing, then most of the time you're okay. But if there is something, at least we get to detect it early. Because cancer, the earlier you detect it, the lower the stage we talk about. Instead of stage 1, you're talking, then it becomes a stage 3. So when you're at stage 1, you actually need less treatment. So you don't need the whole package of like surgery, chemo, radiotherapy and everything. But when you are stage 3, most of the time you have the entire package for that reason.
Yeah. So a lot of people have this perception that cancer is a death sentence, right? So the moment you're diagnosed, that's it. And that's why I think the fear is there.
Correct.
And I remembered when you were explaining to me in your clinic 1 year ago, you said, if you detect it earlier, then we can do so much for you.
Yes.
But if we detect it later, then it's going to be very difficult
Correct.
for me to help you, right? So early detection is something that we must encourage
Yes.
people to, men, women, because all this illness is all about early detection and regular medical checkup.
Correct.
If you send your car for service, we have to send ourselves for service also, lah. But
Yes.
why is it that people are quite reluctant? Is it because financially it's expensive to do for a checkup, or is it because it's just that I have to wait so long? People are putting those financial time, tak ada masa lah, over themselves. I'm not prioritizing themselves. I mean, do you see any pattern, or do you know any reason why?
I have a feeling most of the time is there's nothing wrong with me. Why should I go and check? What if they check no problem? Some people, they have that kind of mentality that, if I don't check, I may not know there's anything wrong. If I know already, then you check. The more you check, the more problem you have. Some people have that. I feel like if something is not broken, do not fix it.
Right.
Okay, but regarding the cost, I have to say, actually in Malaysia, we are very lucky because we actually have very good public healthcare services. Like, some people actually get I think Soxo or Pekeso will send you actually mammogram voucher that you can do it at the nearest hospital for free. So I feel that, this is a good opportunity, that for all women to take up this and then go for your mammogram. Even LPPKN, they actually give you voucher as well. The LPPKN nurse will actually check you as well. Even in every October, you can actually see a lot of hospitals, even private hospitals, are doing very good promotion. So which is much cheaper than the usual time. I think that is actually a good time to actually go for check. So I think cost is not really an issue, because even today you go to government hospital, government clinic, you request to have a mammogram, nobody will deny you access to it. So everybody should go for it.
Okay, so now the access to check for your critical illness is being supported, because I've also heard a lot of support given for mammograms. So
Correct.
cost or financial, there's always way for us to find how that can be funded, right? Then if that has been rectified, that fear has been overcome, then there's another fear about the treatment. Oh, if I have breast cancer, then I'm going to lose my breast.
Yes.
People, patients fear that they have to do a mastectomy, which is losing everything. So is this the common perception, or is this true that if you have breast cancer, that you need to lose your breast?
It's not entirely true. So I think one of the reasons where you ask why patients are reluctant to come for checking, because they say, what if I check our cancer? And doctor will definitely say potong. So they don't want that word. Okay, I understand. Actually as a breast doctor, we actually don't like to do mastectomy. If we can, our principles as a breast surgeon, if we can save the breast, we save the breast. Simple as that. So I think then how can we save a breast? Only when it's discovered in the early stage, when the tumor is small. So when it's like a 2 centimeter tumor, you can do a breast conserving surgery, or what we call a lumpectomy. But today you present with an 8 centimeter tumor, there's no way that we can keep the breast, you see. So that is one thing. So of course, we know that mastectomy is not the only way. So that's what I always repeatedly stress to the patients. Depends, okay, on the scenario. Let's say, unfortunately, when the patient comes, it's already a big tumor, then we have ways that we can shrink the tumor first. So we can actually give chemo first to shrink the tumor, maybe from 8 centimeter. If it comes down to 2 centimeter, we can still save the breast. That is another thing. Okay, if that's it. Sometimes in some scenario, we can actually preserve the breast because of this. Then also we want to tell patient, if let's say for some reason we cannot do a breast conserving surgery, because sometimes the cancer are in patches, like all the quadrants of the breast is actually involved. So it's like it's very diffuse, we call it. Then we have no choice, we have to do a mastectomy. But we also have the option of reconstruction. So that means that we actually do make a new breast for the patients. So these days we actually do it immediately. That means that the moment you went in for a mastectomy, when you wake up, you actually wake up with one of original breast and one new breast. And this reconstructive service is actually available in a lot of major hospitals, not only in private. In a lot of government hospitals with breast surgeon, the services are also available. So if let's say somebody is diagnosed with breast cancer and they are told they need a mastectomy, you should always ask your doctor, can I be a candidate for reconstruction? Am I suitable?
However, having cancer is one overwhelming experience. Losing your breast is another overwhelming experience. Getting a new breast is also a very overwhelming experience. You know, it's a lot to take in.
Correct.
And I cannot imagine for anyone to have to go through that. But you know, life is that things happen.
Yes.
So where and how can people find that support and that strength to go through those overwhelming situations?
Yeah, so sometimes we cannot take all in at one go. It's too much.
Yeah.
We can only go step by step. Like I'll say, in the beginning, we give you the big picture. But then we don't go into a lot of details. When you're at step 1, then we explain step 1 in detail. When you finish step 1, then go to step 2, then we explain in detail. Because by the time patient is a bit more settled, they understand a little bit more. So that's one thing. Understand, I mean, their own understanding of the disease and the treatment plan must be there. That is one thing. Second, of course, we say support. Support from the family, support from the friends. Okay, these are very important as well, because sometimes what we need not only opinions, oh, you should eat this disease, you know, you should do this, you know. Sometimes you just need some very practical support, like somebody to take you to the hospital, somebody to cook for you, somebody, you know, when you get discharged from the hospital, somebody to bring food for you for 2 weeks, you know. All those actually helps, you know. That's what we can do as friends. And of course, we talk about support from workplace as well. A lot of these women are actually in what we call a working age, you see. So you also want flexibility with the work, so that your boss understand and give you some time, you know, to work from home, and then flexible hours. All this actually are the support that the community can provide for a patient.
Right. Okay, so last but not least, I am thinking that for warriors, okay, like myself and warriors out there, or people who are living or being diagnosed cancer, what would your advice be? Like, you know, it's so easy for me now to be a bit more complacent, all right? Because when I first came, it would be like, oh, you know, I'm quite strict. Now it's like, I'm okay.
Yes.
So I might not to say that I'm letting go.
Correct.
But you just want to, I can now go back to doing whatever that I love doing. But there's also that fear, like, oh, is it coming back? You know, the fear of relapse. So it's this love-hate relationship that you have. So what would your advice be?
Yeah, I think the change in the feeling is you're more relaxed now. I think the relaxed now, like what we talked about just now, because at the beginning you have a lot of doubt and you are lost and you have a lot of fear. But after you've gone through everything and then you look back, actually it's something that you were able to do it, you know. Then you're amazed at your own ability to go through all this and you're proud of yourself. So that's why you feel happy and you feel relaxed. I think that is very, very normal. So like what I always tell my patient is that, you know, I think it's hard being diagnosed with breast cancer. Nobody wants to be diagnosed with any cancer. But today, if you were being diagnosed, and then breast cancer is actually one of the cancer with a better survival rate compared to other cancer like stomach cancer or pancreatic cancer per se. Because we can say you stage 1 and stage 2, you have a 5-year survival rate of more than 85%. Which is actually no other cancer can quote such a high survival rate. So being diagnosed with breast cancer and with the adequate treatment that you have, actually this cancer diagnosis is not a full stop to your life story. A lot of people think that I died at this time, you know, they think a full stop, but it's more like a comma. So you pause for a while. Whatever that you are doing, you know, you're busy, you got lost in whatsoever, you're busy taking care of others, put a comma, stop for a while, reflect, take care of yourself well. So then you can continue the sentence again. You can continue the story again.
Okay, I like that. So it's not a full stop, it's a comma, because we need that pause in our life. Thank you so much.
Welcome.
Thank you. I look forward to another year that we can celebrate together. Thank you.
Okay, good to see you again.
Nice to
You
see you.
take care.
Thank you so much. Thank you.